Caesarean section and the management of the dam and the newborn puppies after birth and caesarean sections. And eclampsia, puerperal tetany. C-sections are done when there's dystocia, it can be scheduled or an elective, in breeds such as bulldogs, pelvic fractures, diabetes mellitus, and intervertebral disc disease. If there was previous uterine inertia, a large litter above 9 puppies, or a small litter with 1 or 2 puppies, or highly valuable puppies from frozen semen. So how do you decide if you need to do a C-section? So if there's fetal distress, if there's maternal distress or exhaustion, or if there's green discharge before the first puppy, or a malpresented or oversized puppy or a dead fetus, or if there's no success after oxytocin. For the timing of the C-section, a normal pregnancy is 65 days after the LH peak, or 63 days after ovulation. C-sections are scheduled to be after 62 days after ovulation, and in bulldogs it's 61 days after ovulation. If there's milk in the mammary gland, amniotic fluid is out, and there's an open cervix and fetal bowel peristalsis, this is a green light to do a C-section. For the anesthesia, give midazolam IV, fentanyl IV, and isoflurane and fentanyl. And you give tramadol to the dam. It's the least lipophilic, it doesn't cross the milk barrier. And give naloxone to the puppies post-operation. Don't give A2 agonists, it causes cardiac depression. Do not give barbiturates that cross the placenta. Do not give ketamine, it also crosses the placenta. And do not give butorphanol, it alters the mood of the dam. And it's dangerous for puppies. And do not give NSAIDs, they go to the milk and they cause kidney damage in puppies. For preparation, clip, not in dorsal recumbency. Give maropitant subcutaneously or metoclopramide in the muscle to reduce vomiting risks. Maropitant also reduces the opioid dose needed. By giving amoxicillin clavulanic acid or ceftiofur in the IV, this reduces infection risk. And giving calcium intramuscularly reduces post-hemorrhages. Do not give atropine as it causes fetal bradycardia. For the procedure, have the animal in dorsal recumbency only when the surgeon is ready. Make an incision along the linea alba from the umbilicus to the pubis. Exteriorize the uterus and have an incision in one or both horns and remove the puppies. Close the uterus in 3 absorbable interverting pattern, 1 or 2 layers, and then have an abdomen lavage, and then close the abdomen in 3 layers. For neonatal care, for resuscitation, for the airways, breathing, circulation, ABC. Airways, make sure they're clear and give naloxone. To make sure they're clear, you use a pump suction device. For breathing, make sure there's friction with warm, dry towels. For circulation, use epinephrine, not atropine. And make sure the puppies are warm and correct hypoglycemia with saline and dextrose. Do not resuscitate if there's no response in 20 minutes or if there's congenital defects, such as hydrocephalus or a cleft that's too big to fix. Post-resuscitation, the umbilicus should have a 2 centimeter stump and you clamp at 0.5 to 1 centimeter from the abdomen. And put alcohol on it and then access the vitality. Record the birth weight and then gauge the APGAR score. It goes from 0 to 10. 0 to 3 is severe distress, 4 to 6 is moderate distress, and 7 to 10 is no distress, it's good. And if there's congenital defects, have euthanasia. Eclampsia is acute and life-threatening. It occurs 1 to 3 weeks after birth. It occurs when there's a small or medium-sized bitch with large litters. It's caused by a calcium loss in the milk, and then this stress causes a decreased appetite, and then PTH atrophy due to improper diet and secondary hyperventilation due to dystocia. The signs are tonic contractions of the muscles, which lead to tetany and then seizures. In the bitch, we can see restlessness, nervous, pacing, panting, and whining, and they have decreased maternal behavior. And they can get tetany, seizures, hyperthermia, respiratory distress, and death. The complications are hypoglycemia. To treat acute cases, we give calcium gluconate IV, or glucose and diazepam if there's seizures. In chronic cases, give calcium and vitamin D.